All right, let's get started. Good evening, everyone. Dr. Mehta here from DOC Pain Management. Wanted to talk about a topic here with specifically regards to stress. More importantly, how can you really take ownership of your pain and mitigate some of the stress that you might have going on in your work life, your family life. Um, just the news, the media, lots of stuff going on in this world, and how does that, play a role in your perception of your pain? But most importantly, the strategies here are to determine how can we cope with it better? How can we reduce the stress in our life so that in turn that helps with our pain? Your pain providers in the practice, the MAs, the nurses, the doctors, our goal is to help reduce your pain. And, we spend a lot of time educating you on the different procedures, different medications that might help. And so hopefully these are some options for you to help reduce some of the symptoms that you're dealing with. Um, so with that, let's start with understanding, what pain is. Pain is, chronic pain specifically is something that lasts longer than 3 months, right? And so these are patients that have been dealing with pain for years. And often what happens is that as you develop chronic pain, your brain and your nervous system start to modulate to that pain, right? So they develop a behavior and they start to change because you've been dealing with this pain for a long time. And so we know all the pain fibers are traveling to your spinal nerves and then your spinal nerves to your brain. And so your brain is the housing center to basically process the pain signals and then in turn release a feedback, right? And so that's where stress, that's where different emotions come in. It can make your perception of pain, stronger during the morning hours and, weaker during the evening hours, right? And so the brain has that capability to help us understand the way we're managing our pain. And so with that, there's this cycle of, I have more pain because I have more stress. I have more stress and now I have more pain, right? And so how can we prevent this persistent cycle of pain and stress and where can we intervene, right? Intervene at any point of the way to limit the cycle, right? And so we know stress can increase tension, it can make us more fatigued, and then in turn can increase inflammation, which we know inflammation in our body results to increased pain. And then finally, when we're dealing with this for a long period of time, right now it's more of in a chronic nature, it can create frustration. It can now create more worry about our pain not being controlled. And that in turn can now increase stress, right? So the whole idea here is that we often get caught in this cycle. And so the purpose of this discussion is to see how can we limit this continuous pattern and what strategies can you employ as a patient to reduce the pain stress cycle. And so, it comes from where in the body this the stress happens, right? And so when the body's under stress, our natural response is to release cortisol and adrenaline, right? And in some cases, it's a good response, right? So, you know, um, you see a scary movie, your heart rate races, and your natural reaction is to, hide or turn the TV off, right? So those are natural reactions um, that your body is dealing under stress. Our heart rate increases, our blood pressure increases, we get muscle tension. So that you can understand now if somebody's dealing with this on a continuous basis, right? We're stuck in that repetitive cycle. Now, those normal physiologic or normal effects that our body does to respond to stress, it can actually cause a negative effect on our body, right? So, increased muscle tension over a long period of time can now increase stiffness in the muscles. That can worsen the joint pain, and then that can lead to more discomfort, right? So, um, the normal effect of stress is okay, but when it continues to be on a long-term basis, it tends to have negative effects on our body. And so here's, kind of going back to the brain being a central aspect of how we perceive stress and how we manage stress. And so normally there's a organ in the body called the amygdala. And so that center basically allows the brain to process, stress. And so normally during a stressful system, your hypothalamus and your amygdala, they release a release hormone that responds to your pituitary gland to release another hormone. And then finally, your adrenal gland releases that cortisol level. So cortisol in a normal, patient, normal person helps to calm your body, reduce, inflammation, regulate your energy, kind of bring your body down to that normal level. However, like I said, when your body is on overdrive, you have that continuous stressful environment, that hypothalamus is on overdrive, and then eventually it will shut down. And so that results in lower cortisol levels, which can cause your fatigue, inflammation and higher pain sensitivity. So again, the purpose of this slide is to really indicate to you that the brain is really functioning in helping our stress levels and especially release those cortisol levels. Here's kind of to hone in on that point again, that stress alters the way we process pain, right, in the brain as well in the spinal cord. And so our body is very smart. When our body is used to something, it starts to try to mimic that system, or it tries to, accommodate to what we're feeling. And so our body, meaning our brain, when we're in increased pain, it goes into that fight or flight response. It goes into that response of trying to cope with that pain aggressively. That can create a lot of side effects of what we're feeling, right? So that can create mood imbalances, that can create, sleep disturbances, that can create just overall, this emotional variation. And so, the way we cope with stress will reduce the way our brain is functioning so that we can actually reduce those pain signals and pain pathways. So here are some, I think we talked about this in a different talk of regulating sleep. A lot of the sleep tools can be used to apply to reducing stress. And so, some of the techniques that we educate our patients in our practice on tools to reduce stress. One is simple deep breathing techniques. So simple, breathing through the nose and exhaling through the mouth in a more regular fashion. That can really reduce your heart rate. That can reduce your blood pressure and in turn reduce your stress. We had talked about the muscle tension, right? The stress increases muscle tension on the body. Stretching, doing yoga, doing these exercises can all help reduce those tensions that might be present in a stressful environment. Um, you know, Having time with friends, socializing, watching TV, laughter, music, these are all things that you have to find what's right for you. There's no cookie cutter or secret recipe here that, a specific thing works, but you have to listen to your body. If you enjoy music, maybe listening to the music, um, before you go into a stressful meeting or before you encounter a stressful environment might help you deal with that stressful situation a lot better. Mindful meditation, again, that's a way for your brain to relax. It's the ability for your brain to um, almost reset. And so employing those techniques can be helpful in coping with the stress. A lot of patients get feedback from writing down. And so journaling, reflection, writing down a stressful situation or your interactions with people can be beneficial as a good exercise to articulate what you're thinking, right? Versus actually, maybe have an argument with someone or discussing something over the phone. It's important to have that ability to write something down and then understand, what the processing of that, and then act accordingly. And then again, going on to the tightness of the muscles, relaxation um, can help reduce the overall tension in your body. Here going to some behavioral strategies. So, this goes back to positive reinforcement. And so the way you perceive yourself, right? The way you perceive your pain. Like I had a patient today that said, nothing's going to help me today. There's anything that you can do, but nothing is going to ever help me. And so just the way his perception of his pain, right, created this emotion of just inability to get better. Now that emotion, right, that inability to get better created this behavior on this patient that, nothing's ever going to work for me, and that, I'm basically doomed. And so it's important to know that stress is going to happen in your life, pain is going to happen in your life, and it's your choice as a patient to understand how you're gonna react to it, right? What are your thoughts? And so the flip side, to that patient example could have been that, hey, I know I'm dealing with a lot of pain. I want to get better. I know these are the tools you're telling me that can help me get better. What can we do in that case, right? So sometimes, going into your day or starting your day, say, today's gonna be a great day. Today I'm gonna face the day and we're gonna try to take it one step at a time, right? So your thoughts and your emotions can really dictate how your stress and how you cope with that stress in a meaningful way. And so really just finally here, your providers are here, right? Your providers and your nurses, your medical assistants are here to really educate you on your pain, but most importantly, talk to you about strategies that can help reduce your pain, whether it's stress, whether it's your, family dynamic, whether it's getting you to the right resources. So we spend a lot of time sending our patients to counseling, whether it's a psychiatrist or psychologist, for behavioral strategies to help them cope with pain. And so those are important things to discuss with your provider, because we're here to listen, we're here to help, and we're, most importantly here to help improve your functional life and get you back to what you want to do. Hopefully you all enjoyed this discussion. This will be uploaded to our website for you guys to listen to or share to friends or family or other patients. But look forward to our next discussion next month. All right. Thank you. Take care.